this LERA webinar, what I understand to be the last in the series. I'm Peter Berg. I'll be the moderator for today. We have some excellent speakers, which I'll introduce briefly. I just wanted to say this session is on employment and unemployment effects around the COVID crisis. But as we had been talking in our pre-meeting, on certain questions that relate to racial injustice or class issues would also be entertained by the panel in light of the events that have recently been taking place. It's probably a session that'll be much broader also in terms of the economic impacts broadly rather than just unemployment and employment around the COVID crisis, and particularly impact on workers. So you can use the question opportunity to address a lot of different issues. I would ask you to mute your microphones as we get started to allow the speakers a clear pathway to speak, and encourage you to turn your cameras on. It helps create a visual shared space. I know we're not in a meeting room, but we can replicate some of that by doing that. I'd ask also that we will have the speakers will present very briefly, about 5 minutes each. We have 4 speakers, and after that we'll hold questions until after all the speakers have had a chance to go, and then you can use the raise hand feature or the chat feature to ask questions, and I will work through both of those features to put questions to panelists or to the group of panelists. And then at the end, we'll have a time where the panelists can wrap up and make some final statements. Joel Kutcher-Gershenfeld, who's also a host along with some others who's been instrumental in these meetings, will share his slides and provide the PowerPoint slides that our presenters have prepared for today. You can see that this is the title of the session, and our speakers will go in the following order. Eileen Appelbaum for the Center of Economic Policy Research will begin, then Teresa Ghilarducci, the New School for Social Research, Mike Piore at MIT, and Sue Helper, who will join us in a little bit from Case Western Reserve. So I'd like to just get started and have Eileen, who is our first presenter, kick off the webinar.
Sure. Thanks, Peter. And Joel, are we going to see the slides, or how's that working?
Yeah.
Okay, that's me.
There she is.
Here we go. Next slide. Okay, so I wanted to focus on what has emerged out of the pandemic as a really clear and critical understanding of the role of childcare. It's obvious that we are not going to be able to open the economy and get back to anywhere near what we consider to be normal if there are not childcare facilities to take care of the kids of working parents. So I think this has become really stark. Also, the disdain, I guess, of our Congress folks, in that they have made $450 billion available to for-profit companies that employ between 500 and 15,000 workers. The child care advocates asked for 50 of that. They figured 400 billion would be enough. Could they have their 50 billion to make sure that the childcare infrastructure did not fall apart? And of course, the answer was no. They got 3.9 billion, which is maybe enough to help states keep childcare open for the what are called the essential workers, but it's not going to help us reopen the economy. So I thought I would focus on child early education as really essential infrastructure. I think of it as infrastructure because I think of it as job creating, job enabling, and that it has a high payoff in terms of the kids who go through high quality early care and education do end up having more education themselves, having higher paying jobs, having more and better employment opportunities and so on. So I think that we can make a case for this as infrastructure. And I would hope that when we think about how we're going to put people to work, how we're going to reabsorb those who are not so quickly reabsorbed as cities and states open up, that we're going to think about this as a kind of infrastructure. The bill put forward by the House Democrats and quickly withdrawn, but anyway, really was talking about highways, clean water, all good things. But I do think we need to get early care and education into that same bucket. So we know that in the first couple of, I'm on the other, yes, I'm still talking about this one. We know that in the early period of the pandemic, we saw a dramatic decrease in the number of people who are still employed in this industry. We need to make sure pandemic spending is pushed there. And then post the pandemic, we need to have this investment. It would take a little bit more work than I had time to do to figure out what the employment effects of retrofitting, building, equipping centers that would be sufficient to meet the need and training workers so that we can have expanded staff and higher quality. The job enabling piece, I could do a back of the envelope calculation, which I include for you at the end of the slides. I'm not going to go over it, but you can certainly, anybody can have it. But a back of the envelope calculation suggests that we would have had 2.2 million more women workers in 2019 than we actually had, and that would be a meaningful kick to GDP. And we know from the work that Heckman has done, lots of great work by Heckman, that $1 spent on quality early care and education yields returns to society of between $7 and $12. So we'll go to the next one. And I do think that we need to think about where workers who are displaced from jobs that are never coming back are likely to find employment. And part of that job would be to see what are the qualifications currently of workers who are displaced, what's their age, what's the likelihood they would retrain. But we can see that there are certain sectors, retail being one, where we are highly unlikely to return to levels of employment that we had before. There was already a retail apocalypse underway. People like to blame Amazon, Walmart, and e-commerce. I've done a lot of work showing that you have to ask the question why a big iconic company like Toys R Us could not master e-commerce. And the answer is they did not have the resources to install meaningful e-commerce because of all the money their private equity owners had taken out of them. And now the pandemic is, of course, really hammering retail. And I think that a lot of companies that were struggling, the equity owners are going to feel like it's not worth trying to save them. So I think that not only in this industry, but I just wanted to use one industry as an example, there will be jobs that don't come back. I do expect most jobs to come back. I do think that we will see, the situation will still be very bad at the end of the year. Unemployment will still be high. GDP growth for the year will be negative. But I do think that as we relax the lockdown, we will see jobs coming back and we will see some growth. But I think there are jobs that permanently are not coming back. And for those, we need to give some thought as to how we're going to reabsorb those workers into productive employment. I'll stop there.
Okay, thank you, Eileen. Let's go on to our next presenter, Teresa.
Teresa, start talking and then I'll put the slide up.
Okay. Hi, everyone. I recognize that economists don't take a back seat to anybody, but this time they took a back seat to the virologists. My first slide, Joel, and I only have 2 or 3. And it was really this rare moment when the when the economic policymakers and the politicians did listen to the public health officials and the epidemiologists, and they did it all over the world, and they shut the economy. And when virologists and not a financial crisis or an oil shock shut the economy, we saw that the job losses were a lot different than we see in normal recessions. The responses to this recession by fiscal and monetary policy were also very different, but we are now looking at a very peculiar kind of recession. And I want to get everybody who's listening up for tomorrow's jobs report. And if you have your favorite table, I know you'll go right to that number, but I want to point you to my favorite table, which is table B6. It comes from the employer survey, and it zeroes in on the industries of who's been protected from the downturn, who hasn't. I also add in my own little numbers, which are the share of women in those industries, and then I just like to weight it, by the employment. And it turned out, and this is, I can't believe how well my presentation and my thoughts really merge with Eileen's. Here is what happened in April. I'm waiting to see what will happen in May tomorrow, just like you all are, that we saw that leisure and hospitality lost half their employment. But utilities and financial activities barely budged. They lost something. They're only 99% of what they were in March, and financial activities only 94%. But here you see I've ranked it by severity of the loss. And then you look at the concentration by gender, and women here are disproportionately the losers in terms of being on the sideline. But there's another part of the economy that's in overdrive, and that is also an economy that's dominated by female labor, and that's care labor. So when kids go back home and elders are isolated, it falls on women primarily to do the housework, the home teaching, and the child care. My work is on the older end of the demographic scale, and I can't tell you how much of a pressure it's been for daughters and daughters-in-law to deal with their isolated elders when the home health care workers, again dominated by women who have been sidelined, can't do the work for their family. So we have unpaid female labor on overdrive, and we have female paid labor disproportionately on the sidelines. The industries that have been deemed essential are the ones that have been relatively insulated from job loss. Okay, now my second slide combines that table, our look at B6 by which industries have lost the most, with an analysis, and I just picked one, Josh Bivens' analysis of what industries are high value and what industries are low value in terms of their job multiplier. I am very much impressed. I'm thinking a lot about a little paper by Harvard's Professor James Stock he gave at Brookings. He was about the only economist that said, hey, the rules for the road for reopening require protection of workers. But he also told policymakers to make sure that when you reopen, identify the low value, high contact industries and don't open those. Identify the high value and the high contact and spend the money to open those. And again, Eileen and everyone else, education and health services are just hard to talk about. The multiplier of K through 12 and of childcare is undervalued. K through 12 is childcare. It's free childcare. Without releasing those kids or those jobs, you are going to hinder. It's a sleeper issue in the recovery. So I am really following behind Eileen, happens to me a lot, but that we need to concentrate on those sectors. The next slide. What I look forward to, meaning I don't anticipate it with glee, but what I expect to happen in the post-COVID economy, and this is exactly on Eileen's point, is that private equity is going to wait to snap up the losers and the limp and the weak. And there will be just not private equity, but there'll be more monopoly and therefore more monopsony power. This will mean that there'll be less labor bargaining power. The employers will be more powerful, but labor will have this continuing slump from a rolling recession. And we'll have more wealth inequality like we always do after recession. And this will need a lot more government support and a different way of conceiving of social insurance. And one of them is to lower the Medicare age to age 50 and make it the primary payer so that older workers won't have a cost barrier when they want to be reemployed. If employers wouldn't have to pay the health insurance for older workers, it may make their recovery easier. I'm done.
Great, thank you, Teresa. Excellent points there as well. Let's go to Mike Piore.
And Mike, you get started and then I'll put the slides up.
Okay, so what I'm going to focus on is something which I think has been largely obscured by the focus that we've had on the numbers, both in the economy and in the of the people who have been affected in various ways medically by the virus. But underneath these things that we've been looking at most closely, there, I think has emerged a kind of moment of change where the fundamental principles on which our social welfare system is based are open to change. And they're open to change because there's a sharp contrast between the social welfare system that developed, that emerged out of the New Deal and has dominated social welfare policy in the post-war period and in this latest several decades of the new century. There's a sharp contrast between the principles on which that policy is based and the principles embodied in the CARES Act, which is the principal public policy act of the present period. So the New Deal system is basically an individualistic system based on contributory social insurance, and eligibility is linked to employment. And Social Security is kind of the model for the most of our welfare policy. Underneath this individualistic insurance system, there has been a second need-based system, which is supported by a patchwork of special programs, public assistance, food stamps, essentially. But that system is essentially a system of state charity. It has no coherent logic in itself, and it's in many ways an afterthought. The provisions of the CARE Act, though, offer a really startling alternative. And there are three principal public welfare provisions. One is a universal cash grant to individuals and families. I emphasize the term universal. The second is a cash grant to unemployed, which is complicated, but it is basically an unemployment payment, which is independent of previous contributions to the system, and which includes people who have been left out of the present system, particularly freelance workers and independent contractors. And finally, a third provision is a support for medical expenses, which are linked to coronavirus, but again, they're independent of employers or on previous worker contributions. So there you have a sharp contrast between two systems, one a universal welfare system with support as a citizenship right, independent of employment. And the other is the old New Deal contributory system. And the question is whether this is a discontinuity or a change in our approach to social welfare, or is it just an aberration that is due in some ways to the way in which the CARES package was thrown together. And I think it's significant in the light of that dichotomy to say that there's almost no discussion of the difference between these two approaches to social welfare. The whole debate in terms of public policy has been centered on the alternatives of opening the economy, which is an economic necessity on the one hand, and the biological or the medical necessity of social distancing and how to manage it. And whatever you think of this debate or however you come down on it, what's interesting to me is that social welfare provisions have all been discussed in instrumental terms, as if they really encourage people to stay at home, or do they encourage people to go out and work in public spaces and discourage them from staying at home. But in fact, if you look at these provisions, it's not clear that they have either effect, and that one can really incorporate them or fold them in easily to the debate we've been having about the economy versus the medical or biological aspects of the epidemic. So the question is there an alternative? Well, I guess I should say that I really believe that what prevails in terms of social welfare, how we approach social welfare in the future, is really going to depend on how, in the long run, on how we interpret and talk about these provisions of the that could lead to a new social welfare system. And so the discussion that we're not having is really going to be very important in the in terms of the future. And it seems to me that one way of thinking about it that does recognize the legitimacy not only of the approach which is embodied in the CARES Act, but also of an alternative approach in general, is that what we're talking about is the management of social risk, a social risk that in principle is shared by the whole of the society. That is, the coronavirus has not posed a challenge, the challenge which it poses is to the whole society. It's not just to individuals. And these are risks which are generated by the nature of the world we live in. I think one could point to globalization as being a prime factor in the generation of these risks, but in some ways it's not enough to, in my mind, to truly explain why they're emerging at this time. But one can understand the CARES Act as a way of mitigating the effect of the maldistribution of risk. And in that sense, it joins the whole issue of the maldistribution of income in the society. It's not a separate set of issues. It's closely related and integrally entwined with the growing inequality of income, which has been a preoccupation of policy for the last several years, particularly in the side of public policy that most of us here are associated with. But it's not just the virus risk that has emerged. We've experienced in the last several decades the international terrorism risk associated with 9/11 and the financial risk associated with globalization, which was responsible for the crisis in 2008. So I'll leave it at that. I ask you to think about these alternatives.
Great, thanks, Mike. So lastly, Sue Helper will give her presentation, and then we'll open up for some questions.
Great. Well, thanks a lot. I'm really grateful to be here and talk a little bit about supply chains, which are, I guess, come to the forefront. And I guess I want to make this kind of a bold statement that what we have in the U.S. and globally a lot is a lot of what I'll call low road supply chains, and that makes COVID recovery more difficult. There's obviously different kinds of supply chains managed different ways in different places, but I think this is a broad trend. And the idea is that there's a lead firm that designs a production process so that suppliers and workers focus on narrow specialties. This makes it very easy to be a supplier or a worker. So there's lots of entry, and means the lead firm that controls some kind of bottleneck will capture the majority of the profits. A problem with this system is that it reduces slack and flexibility. And so what I want to talk about really quickly is two examples. A lot of the discussion has focused on international supply chains, so the lack of a manufacturer of personal protective equipment and pharmaceuticals in the U.S., and that's a cause of problems. I agree with that, but I also would point out that there's huge disruption in a supply chain that's largely domestic. So to talk a little bit about meatpacking, which is a really high percentage of U.S. COVID cases, and a lot of it has to do with the production process there. There's a very minute division of labor. It's designed to be very easy work to learn. Workers are, and they really, even ever more relaxed regulation on line speeds, which means that workers are extremely close together. It's very noisy, so to be heard, you have to go and shout in someone's face, spewing virus probably. And the people who take these jobs are immigrant workers that don't have a lot of alternatives, and there's a lot of pressure on them to work when they're sick. So a significant percentage of cases in the US are concentrated in this one industry. It's not inevitable, and this is a case of jobs that, through a lot of struggle, were made good jobs. Many of us have read The Jungle, published in 1901, of horrific conditions, a lot of organizing, and from the 50s through the 70s, these were jobs that are maybe not comfortable, paid an income. There's a really good book called Packing House Daughter, PhD, and it describes the author's experience growing up in a meatpacking family and getting a PhD in English, basically based on the earnings of her father. So we've seen a decline in wages, almost in half. And it's partly related to a change in supply chain, so that the plants are now in rural areas near the cattle, and as opposed to in urban areas near the consumers, so harder to organize. This de-skilling of labor and seeking an immigrant workforce all kind of work together. In other parts of the supply chain, there's really narrow skills and narrow focused equipment, and that hinders this shift from restaurant to household consumption. So farmers are dumping, plowing under carrots, killing hogs, dumping milk, because the quantities that the restaurants buy and the equipment that restaurants have, say, for example, to use milk where they want 10 gallons at a time that they put in a big dispenser, it's not so easy to transfer to these grocery store supply chains. People lack the contacts. Anyway, it's quite a rigid system. The auto industry is an interesting case because it's both a little bit of both a problem and an alternative. And so when you look at the employees of Ford, GM, and Chrysler, you can see that there's been some maintenance of power, and that this power actually, I think, redounds to the benefit of all of us. And so when we think about policies for the future, that more worker voice is important, not just as an end in itself, but it also increases or helps us meet the goal of supply chain resilience. So we almost didn't have, domestically owned auto companies if the U.S. and Canada hadn't stepped in 2010 and explicitly rescued General Motors. There was an implicit rescue of Ford. Both of these companies were able to take a kind of general expertise that they have in terms of identifying suppliers of parts and equipment. So, and GM supply sourcing team found and identified 900 suppliers of ventilator equipment over a weekend. And then they also have a broadly skilled production workers that can transition from making automotive parts to, operating sewing machines, doing complex assemblies, because they have basic training that the UAW part wishes for. On the other hand, there is this internationalization that is going to make it difficult, I think, to restart. That when you have parts from 30 countries that you need, each of the 30,000 parts in the car are needed. When you have rolling shutdowns, it's going to be pretty hard, I think, to have a smooth restart. So I just want to kind of lay out very quickly, this is my last slide, policy principles. I think there's a bipartisan agreement about bringing back supply capability to the US of certain industries, particularly in the medical field. I think that's good. I think that won't happen unless you also think about demand. We've kind of seen this movie before. People may have followed the Washington Post articles on a company called Prestige Ameritech that built up during the H1N1 swine flu the ability to make a whole lot of masks in the US. After that was done, the company's hospitals went back to China because it was cheaper. And so this guy was left with a whole lot of capability and investment. So we need to make sure that doesn't happen again. A second issue is to make sure that if there is some kind of government investment, that it actually goes to good jobs and productive investment. So you need worker voice to make sure that there's proper PPE, that production processes are safe, involve social distancing. You need safeguards to ensure that federal money actually goes toward production of equipment and not stock buybacks, paybacks to investors, etc. So I think those are three policy principles. The LERA's concern with good jobs, I think, is and should be central to this discussion, and look forward to our continuing discussion on this.
Thank you, Sue. I just want to start by highlighting a few things that people said and then open up for a question. I think, the presenters emphasized a number of things, which I'll just briefly summarize. And, certain sectors, there are enabling sectors and enabling institutions that can help move us into a recovery stage, into re-engaging employment and identifying, childcare education and how these have differential effects by gender is important. And thinking about what sectors actually multiply those effects is important to do too. And looking at institutions. And part of this discussion I think we have is about a reopening or re-engagement of the economy. And I think Mike was pointing out that what are we re-engaging or reopening to? It isn't like the virus is suddenly going to go away. We're opening up into a new environment and a new space. And understanding that new environment and new space is going to be important. And I think Mike's pointing out that may in fact lead to discussions of a new social welfare system. One of the things that's been highlighted by this crisis too is the social nature of our problems. When you have a public health crisis, it's a social problem. And that, I think, when Mike talks about managing social risk, allows for discussion of lots of different things to come in that. Not just inequality, but the issues that we're now seeing conflated with COVID around racism and issues around financialization and other things that affect us as a group. I think Sue's point too about there are many different aspects of the economy around the supply chain where how do we facilitate and improve supply capabilities, but how do we improve good jobs in sectors as well? So in light of those, number of different topics have come out. I do have a question that came through on the chat from Dion Polar for Mike Piore, and it relates to what extent cash transfers as part of the care system has led to debates about work disincentives. I think here particularly around UI transfers and how that may affect this idea of work disutility as you open up the economy. And she talks about in Canada that there's a lot of discussion about now as you open up, there's disutility to work. And would this push us back towards a New Deal kind of social policy, or would it push us to something that's more along the lines you were talking about of a different sort of social policy? So she then ends with, do you think this will happen in the US, this idea of moving back towards the New Deal? Or will the crisis actually lead to greater support for basic income types of cash transfers? So Mike, why don't you take that question first?
Well, I think where the crisis is likely to lead in which direction depends very much on how we talk about it and how this debate is managed. And there really hasn't, as I said before, the debate hasn't really been engaged. The one thing that I've heard from the conservative Republicans is about work disincentives built into the subsidies to the unemployment insurance system. But I've been working on the labor shortages in the nursing care, home care industry, the nursing home care. And there, people's attitude towards work is dominated by fears of getting infected themselves, of bringing the infection home, and of passing it on to their family. So the question is how much, that is, what is the impact of the unemployment disincentive to work to the extent that it really is there, and relative to these other factors. And I think we haven't, I haven't seen anything that tried to separate out the factors that are keeping people at home.
Okay. I also want to give a chance to the speakers to have a chance to talk about what they heard from the other presenters before going forward. I think would be a good idea. So Teresa, why don't you start us out?
What Susan's presentation, her last slide, reminded me of what the financial community is saying, is that after COVID, the cost of production are going to increase. So I just want to say that again. The supply curve is going to shift in. The cost of production are going to increase to the extent, and we need more. OSHA increases the cost of production, and to the extent that we have to shorten the supply chains, that will increase the cost of production, which made my prediction about monopolies being the only ones to survive and wealth inequality growing salient. I'm just wondering what Susan or the other folks think about that. It's going to cost more to produce every product after COVID.
Susan, do you want to weigh in on that?
I guess I'd say two things. So one is that some of what we're doing is just incorporating hidden costs, right, and just making them explicit. So hidden costs of, taking advantage of exploited Chinese labor, of unpriced environmental externalities, of, horrific conditions at ports and things like that. But whether that then leads to monopoly, again, I think that there's a choice. and that it is a really ever-present, should be ever-present in our policy design. So there is actually a bill, bipartisan bill, that wants to reshore a whole lot of supply chains with, tens of billions of dollars every year. And I don't see in that bill a lot of attention either to maintaining demand or of good jobs or of sticks. So I think that is a really important and ever present, but I think not inevitable outcome. So you could imagine, breaking up as a result. So you see these individual pork plants that supply 5% of US pork demand, and one person gets infected with COVID there, you could shut those down as public health problems as well as antitrust problems. So that you could have, as a result of this, a resurgence of antitrust. You could condition aid on preventing stock buybacks. So I think there's things you could do. But I think it's really important to raise the issue and to push hard, even though Republicans don't like it. They're all in favor of corporate welfare. But I think that what you raise is very much potentially an outcome.
Yeah, so I think that we will see the increase in consolidation, maybe not for the reasons related to increased cost, but because we are designing policies. At this moment, we have policies that are creating that outcome. They exist. The CARES Act gives away, first of all, it gives away $450 billion with no strings attached and very little in the way of transparency. But worse than that is that $450 billion provides a basis for the Fed to take up debt of these companies to a tune of as much as 10 times as much. Now, I don't know that the Fed's going to go far, but all of the policies relating to the Fed special vehicles for special facilities, bailing out businesses, really have relaxed any meaningful constraints. It should not be possible. The Fed usually takes on debt that it can believe will be repaid, which means that private equity is usually excluded from these programs, but they have relaxed what debt they will take on, so the private equity is involved. Junk bonds are usually excluded from these programs, but ETFs that are filled with junk bonds are going to be backed by the Fed. That's why you see the market going up the way it's going up. It's quite clear that the Fed intends to protect all of the large companies in this country, to bail them out. That's where the consolidation is coming. And if I can just take a simpler case than the Fed so that you can really see it, if you think about how the CARES Act is supporting our healthcare system, our hospitals, our doctors, our other providers. It gave out the first tranche of money. It had $100 billion to spend and another $75 billion added to that. It gave out the first $30 billion based on the share of a provider's Medicare population in 2018. So that's not COVID-19 because we're looking at 2018. And secondly, the safety net hospitals, the rural hospitals, they have mainly Medicaid patients or non-pay patients rather than Medicare. They got little to none of that money. The second tranche was given out based on your private payer, insurance companies and private payer, not government revenues, patient revenues. Well, that's how the academic medical centers have all made out like bandits. The things that are the financialization of hospitals to begin with is outrageous, but it's them that have gotten the most out of the CARES program. I will be shocked if our rural hospitals and our safety net hospitals survive the current pandemic. They are in terrible trouble to begin with, and this is only making it worse, and every policy is designed to disadvantage them. So there's no question in my mind that consolidation is going to proceed, that inequality is going to rise, and it's mainly Fed and Treasury policy that are responsible.
Yeah. Mike, do you want to add some things?
Yeah, I just want to talk. I would put the emphasis on how one presents all this. Yes, costs are increasing as a result of this pandemic, but the costs are real costs. We aren't as rich as we were before, and the cost of living, of existing, has increased. But there's a separate question, and that's how is this increase of cost going to be distributed throughout the society and the economy? And I think it's really important to make it that distinction, because when we're talking about distribution, they want to say you don't recognize the cost, and we do recognize the cost, but the question of how you distribute that cost is not inherent in the cost itself.
Okay. I've got a couple of questions here. Robert Mikowski makes a comment. Why don't we change ECE to stand for early childhood employment, ensuring the value of all people, not just early childhood educators? So I don't know, Eileen, if you have a comment on that.
Yeah, I thought I did try to make that point, that it is job enabling, not just job creating. And yeah.
Yeah.
I don't object to you will certainly create employment in early care and education, but that will enable a couple million women to be able to join the labor force and pursue whatever career they want.
Gary Klipfer has a question for Teresa. I may have misunderstood Teresa, but I believe she stated OSHA increases to cost of labor. If this is accurate, can she explain her position in more detail? Increases, I guess OSHA increases the cost of labor. Could you explain that in more detail?
Yeah, I would like to know what the other speakers say. It's like all the cost of regulation. And if you're going to employ people, you're going to have to provide more PPE. I hope. We do need an emergency standard for OSHA. But infectious diseases require different kinds of workplace practices, and that usually is an expense. Amazon, for instance, said that their second quarter profits were down because of their increased hygiene. That's what I meant.
Yeah.
But it's not creating the cost. That is, the cost is created by the risks that regulation is attempting to address. And if you don't address those risks, especially, well, not especially any of the risks, but we have a lot of new risks that we're recognizing. If you don't address it through public policy, you impose it on individuals. And on the whole, you impose it on poor and politically weak individuals.
Yeah.
But I guess that puts words in Teresa's mouth. I don't think you're saying that. I think you're saying that if we're not careful, if we put in those kinds of rules, we'll end up with a monopoly.
Yeah, right. That it'll only be Amazon that can afford it. But it may be necessary. It's necessary, but it will have this effect.
And I think that, it definitely does increase barriers to entry. We see this pollution regulation that, really small companies, sort of fly-by-night companies, this is hard for them. And I actually think those companies shouldn't exist, that they aren't,
exactly.
They don't have enough capability to really, provide good jobs. And so having little tiny fly-by-night companies be bankrupted by necessary social regulation, I don't have a problem with. I think, it's the problem that the creating more behemoths that where there's an issue. But I don't think that, I'm very skeptical of the idea that we shouldn't have certain necessary regulations because it's hard for business. They should be able to, administer those things.
Yeah, I'd like to just get the panel to weigh in a bit on Mike's point around a social welfare system, of whether we think this crisis will lead to a shift away from sort of that employment-based system towards something more universal. There's been a lot of discussion about these things in general, but would this crisis, do you think, be a catalyst to actually change some aspects of that system, be it in healthcare, be it in employment relations or something else.
I mean, I'd like to see both. I'm very worried about just a universal basic income because I think work has dignity, gives meaning to people. It also is a source of power that ordinary people can have to come together around work. That said, there are people who, for no fault of their own, are unemployed and they should not be left to starve. So it seems like if we can strengthen both, I guess I don't see that there's a conflict. That can't we do both? Have a universal health care, but also in this time of crisis, funnel money through companies on the condition that they keep people employed and maintain those ties.
I'm predicting an expansion of the social welfare state. I don't know if a complete shift away from employers, but there are two things that I think have legs. One is a la Elizabeth Warren's proposal, raise Social Security benefits by $200. Now, there is no pressure to raise the retirement age anywhere on the horizon. So we've protected some of the drawbacks in our social insurance. And I think that we'll drop the Medicare eligibility age. And if I could just add that other little fillip, make it the primary payer for employers. I think that's the incremental move away from employment-based social insurance in that area.
Yeah, that's a really interesting point about the Medicare 50. Do you see any interest in Congress in some of these issues, Teresa?
Yeah, I've been talking to a congressional member, Representative Larson, and I had a conversation right at the beginning of the pandemic. Joe Biden has said he wants to drop it to 60. And there's about 3 other bills that wanted to drop it to 60 and 55 before. So 50 is actually the better number, not just because it's lower. I mean, somebody said 15 minutes, at birth would be good, but dropping it to 50 has this targeted effect on the largest and the fastest growing segment of the labor force, and happens to be our demographics, is that we have to lower the cost of employing our big chunk, or we're going to suffer the lower bargaining power for all workers. So how older workers are treated, it's now going to be 35% of the labor force, will spiral down to the rest of the labor force.
Yeah, I mean, go ahead, Eileen.
Another thing that I think is very close to being able to pass is paid family and medical leave.
Yes, that was
Getting presented before, but is there anybody who would stand up today and say, no, we don't need to have paid family and medical leave? We've gotten little bits of it into the Families First, the very first, the second Corona response bill that was passed. But a huge push right now. You see it in the HEROES Act, but even if it doesn't pass as part of that, there's a huge push. There are more and more people in Congress. I mean, we're up to well over 200 in the House that are co-sponsors, and close to 40 or so in the Senate. So this is something I think is going to take the ability to determine whether you're eligible for paid leave and the actual paid leave out of the hands of employers. Nobody in the paid leave community thinks that employers should be paying for those kinds of extended leaves, talking about increasing costs, whereas if you spread it out over the entire workforce, these events which loom large in your life and may affect a lot of hospital workers, but not too many steel workers, are relatively rare, so to speak, at least not very expensive to handle when spread out over the labor force of the state, much less the labor force of the country. So I think this is one that everybody can understand can happen. It's really cheap, and it doesn't in any way threaten the power relations in the society. What we are not getting, and what I don't see happening, are any changes that will, in fact, in some way threaten the power relations.
Yeah, I think that question of, do we see any kind of worker voice change? The idea of alternative forms of worker representation I don't see that push politically, and I don't know that it would come out of this crisis. If anything, you look to these sort of maybe more universal rights statements where you have an individual right to this or an individual right to that, maybe more along the Australian, 10 basic employment rights or something. I do want to give a little bit of time to our panelists. We've got about 5 minutes. If they have some final thoughts or to wrap up that people want to emphasize, or other things that we haven't really got on the table yet that you think are out there that we should address.
I have a question just about that last comment you made, Peter, that, this seemed like a great time to say that there should be elected health and safety committees. That, how do we know what's the right way to bring people back, what's safe, what's not? At some level, employers should want to know, if there's parts of the plant that are unsafe. It just seems like that could be a demand that's being made. I really don't hear it, but wonder why or how that.
I think that's a great point. And you can run a health and safety committee inside how labor law is structured if you allow for the way you actually select those workers to be on that committee, whether it's in a unionized environment or not. And that actually may be a wedge issue now with the health and safety to actually put that forward. I was thinking if a broader set of rights where we really get stymied is in the idea of a works council, where some kind of local workplace-based form of representation separate from unions that are voted on is really difficult in our environment, given the way our labor laws are written, and would require some broader labor law reform.
Could I just
Yeah, go ahead, Mike.
I think that the story is just beginning, and that if we and it's really hard to say what the events are that is likely to transpire in the next year or so. But if it becomes very hard to open the economy, if it's hard to get people to come back, if people are really concerned about health and safety, then one can imagine when that obstacle is faced, if that it will be an opportunity to suggest various kinds of worker consultation at the plant level. And I think the same thing is true of the pressures coming out of the Black Lives Matter movement, because everybody, I mean, it's amazing to hear people say about it, all sorts of people say how the system is white supremacist, but how you change the system is a really open question. And again, if we can imagine and present ways of changing it through worker participation in the shop, it's a new ball game, I think, given the kind of pressures which the society is facing, recognizing, I guess, because the pressures in some ways have always been there. But I mean, 30, 50 years without responding to the issue of white supremacy, when we've been talking about it all that time, it should give one pause as to how one structures, how the society restructures itself, I guess, how it even thinks about restructuring in a coherent way.
Yeah. Teresa, final thoughts?
Well, it's depressing, but I think that I predicted all the forces will lower bargaining power for labor for quite a while, Peter. We may get paid sick leave. I think that might happen. We may get family medical leave act. We may get more support for older workers and older people. But unemployment has a habit of rising, even after the recovery starts. So I don't see anything that will change the labor market structure as you so well put, Peter. I don't see any different forms. I think this health and safety committee idea is fresh, and that's a sliver of hope. That's a green shoot.
Yeah. Eileen?
Yeah, I think it's been pretty well covered. I guess I would just say one other thing, and that is one of the as we step back from all of the kinds of social programs that we associate with the New Deal, we look to the family, we privatize, so to speak,
Mhm.
of what we ought to be providing as a society. And going with that, we have idealized, even to this day, you know, the two-parent family with a couple of kids as the ideal and the best way to raise children, and so on and so forth. And a lot of that has been shown not to be true. Not that it's a worse way, but there's not measurable difference between kids who grow up in two-parent families and other kids controlling for the other kinds of things you need to control for. And we have demonized single-parent families. We've talked about it as the destruction of the family and the failure of the family. Well, this is a big part of marginalizing Black women. So anything that can change that conversation to say these are things that are socially, need to be socially provided, that families can't be expected to do this for themselves. And especially families that have been disadvantaged, as Mike was saying, by white supremacy and white privilege. I think that's a piece of it that we have to keep in mind. I haven't thought about it that myself so much either in the past, but I see the family structure, and idealizing one family structure over others contributes to many, many problems in the way we treat people.
Yeah. Sue, any final thoughts? Okay. Well, thank you very much, everyone. Enjoyed the session. I want to thank our presenters and all our participants. We appreciate LERA for hosting this and bringing this together. So thank you very much to Emily and the staff at LERA for doing this as well. And take care, and hope to have some more of these at another time. Thanks.
Thank you. Thank
Thanks.
you. Bye, everybody.
Bye.
Bye.
Thanks.